Nepal ranks 6th in the world in having gallbladder cancer incidence. Okay, maybe because of the lack of medical facility, or maybe something has to do with our environment, or maybe something has to do with genetics. So Nepal,
or maybe even lack of information.
Absolutely. Most common questions, one of the most common questions asked to us after surgery, even before surgery, is Doctor khane kura ke khane bhanera. Right.
We will come to that.
Yeah. But we tend to say whatever we feel like. But generally, people don't tend to believe us.
Right.
Now you are the live example, like we have shown in you only. So now I believe that people will believe us. Yeah. If we remove the gallbladder, what happens? The manufacturing unit is still working. I mean the liver. We haven't touched the conduit, that's the common bile duct, connected to the intestine. So there is nothing, I mean like there is no harm in removing the gallbladder.
This is just harmful
China. Absolutely. Also,
like kati times drinking or smoking?
If you ask me, I will never allow a patient to have a drink, smoking and drinking. Okay.
के भयो
लौ नानी मेरो त फोनै हराएछ
हेलो
त्यो तपाईले अहिले कुरा गरिरहेको फोन त मेरो हो नि
त्यस्तो महँगो फोन पनि खसाउँदै हुनुहुन्छ
कहाँ हुनुहुन्छ तपाई अहिले
म अहिले यहाँ भ्रिकुटी मण्डपको गेटमा ठ्याक्कै बसिरहेको छु है त्यहाँ लिन आउनुहोस् है
ल ल ल
हेलो
म त यहाँ भिडकुटी मण्डपको आइपुगेछ तपाई कहाँ हो खै
गङ्गालाल हस्पिटलको गेटमा छु त्यहाँ आउनु पाएन म
कहाँबाट गङ्गालाल हस्पिटल फेरि तेरी
1 मिनेटमा है तुरुन्तै
फेरि गङ्गालाल हस्पिटलको गेट
हेलो
ल म यहाँ गङ्गालाल हस्पिटलको गेटमा छु तपाई कहाँ हुनुहुन्छ
ए म त यहाँ अहिले बनेपा आइपुगेँ हैन
बनेपा
फोन लिनले बनेपा आउनुहोस् है
होइन के तालको मान्छे हो तपाई
ल तुरुन्तै 1 मिनेटमा
लौ न तुरुन्तै नजिकैको दूरसञ्चार कार्यालयमा गएर मोबाइल सेवा बन्द गर्नु पर्यो नत्र दुरुपयोग गर्ला है भन्दिया छु मैले
सम्बन्धित दूरसञ्चार सेवा प्रदायकको कार्यालयमा गई सिम बन्द गरौँ र आफ्नो नाममा भएको सिमको दुरुपयोग हुन नदेऊ.
Hello and welcome to another episode of Monday Blues with Subhash, powered by Coffee Baby and sponsored by Nepal Telecommunications Authority. Season 3 is almost coming to an end, and it's okay, life goes on. Since someone once told me a very inspiring word, ki life isn't a bed of roses, you have to get through various thorns to make that life a beautiful bed of roses. So it goes on, and with that, I'm back to my studio again after the 4th episode, and but I have a very, very important guest with me. So here's the thing what happened. I was operated a week ago, and we'll go further to it. I was operated and kismat I don't know. Today my guest is a doctor, and doctor you will get to know him better. So without any further ado, let me welcome my guest, Dr. Rakesh Shah. Hello, doctor. Thank you so much for being here.
Hello, Subhasi. Thank you so much for being here and calling me here. And I'm here because of you only. That's one thing. And the second thing is that I'm glad that just a week after surgery, we are here on the podcast. That's amazing.
See?
Yeah.
Because, okay, so let's get to this point, Manam, na?
Yeah.
So I was operated a week ago.
Absolutely.
Right.
Yeah.
Gallbladder ma stones tekeko थियो, which is obviously a true fact. And usually मान्छेहरुको कस्तो perception छ भने चाहिँ when I told my closest people, like I did not make it public, oh I'm having a surgery and all, but when I told it to my closest people, they were like, some of them knew ki what kind of surgery I would get into, but some didn't know ki कस्तो खालको operation surgery I would be getting into. So the surgery that I had got was the laprascopy surgery, if I'm not wrong.
Yeah.
Right. So a lot of people know about it, and a lot of people don't know about it, Pani. So what is that surgery that you've been doing and you've been practicing for people, those who have the stones, dekhine, what is it like?
Basically, coming to the surgery itself, we call it laparoscopic cholecystectomy, and it is one of the most common surgery we as a gastrosurgeon do throughout our life. And it's a surgery, we call it a benign disease, surgery for the benign diseases. And this laparoscopic surgery, we also call it a keyhole surgery, in which what we do is we make certain number of holes in your abdomen and put a camera in it and through one of the holes, and then put another instrument through rest of the 2 or 3 holes we make, and then we remove the gallbladder for this particular case only. However, this surgery has been in place from 1980s basically, so it's more than 4 decades now, and it is also one of the most common surgery performed throughout the globe as well. So in this surgery, there are various names given by different scientists at different point of time. So we also call it a minimally invasive surgery, we also keyhole surgery, or we also call laparoscopic. So we see into the monitor. Now also robotic surgery has come into place, but it's just an extension of laparoscopic surgery. However, the principle is same, and we have been practicing it, and myself as a surgeon have been practicing from last almost 1.5 decades. For last 15 years I have been practicing this surgery. So the benefits of this surgery is that early recovery, as I have seen, and generally the popular belief these days, in common in our part of the world is like just after surgery, people start taking, they are not allowed to take for almost 24 hours or maybe 36 hours. But what we practice is we are trying to extract all the benefits of this minimally invasive surgery. So we generally allow to have food just 3 or 4 hours after surgery once the patient is up and about. Patients, once the effect of anesthesia has gone and the patient is conscious, then we allow the patient to have whatever he or she feels like. Most of the time, you must have seen even your mom was surprised to know when I asked her to feed him whatever he feels like.
Right.
And most common questions, one of the most common questions asked to us after surgery, even before surgery, is Doctor khane kura ke khane bhanera. Right.
We will come to that.
Yeah. But we tend to say whatever you feel like. But generally, people don't tend to believe us.
Right.
Now you are the live example. Like we have shown in you only. So now I believe that people will believe us. Yeah.
Okay. Since you said ki laparoscopy is very minor, and it's a worldwide practice. 1980s देखि को start भइरहेछ. It's a 4 decade way of surgery यस्तो भएको छ भनेर हैन. So कुरा आउँछ perceptionमा.
Absolutely.
हैन. So मान्छेहरूलाई when you tell कि okay तपाईको यहाँ gallbladderमा अथवा किडनीमा stones देखेको छ, that has to be extracted through this.
Yeah.
मान्छेहरूले चाहिँ मान्छेहरू आत्तिने अथवा डराउने अथवा mentally prepared नहुने. I was very prepared for my operation the day when I met you. I was like, okay, yeah, let's do it. I don't mind. I did that.
Yeah.
Right. तर मान्छेहरूको perceptionमा चाहिँ कस्तो हुन्छ नि, होइन मलाई डर लाग्छ अथवा यो इफेक्टिभ त्यो हुन्छ नि, डर
हजुर
हार्मफुल छ कि नै, के छ कसो छ भन्ने हुन्छ नि त. What is it like? के चाहिँ हो त?
Absolutely. See, the perception of people like jun dor lagne cha, there is something called fear of unknown, because most of us is not aware of how the surgery goes on or how the surgery is done. So the very reason we ask people to remove gallbladder after this, once we detect anything abnormal in the gallbladder, is that first of all, gallbladder in Nepal especially, I'm telling you, gallstone or gallbladder stone or gallbladder polyp मासु पलाएको जुन
नेपालीमा पित्तथैली निकाल्ने,
हजुर पित्तथैलीमा जुन पत्थरी हुन्छ अथवा पित्तथैलीमा मासु पलाएको नेपालीमा भन्दाखेरि, these 2 are the most common causes of gallbladder cancer. Okay, that is the one of the most scary part of it. I'm telling you.
I'm alive.
Yeah. So, gallbladder cancer per se is a very nasty sort of disease, and we want to treat gallbladder disease before it turns out into the cancer or the malignancy, we say. Fine. So, and it's surprising to know Nepal per se, and Nepalese people is one of the like susceptible to gallbladder cancer because Nepal ranks 6th in the world in having gallbladder cancer incidence. Okay, maybe because of the lack of medical facility, or maybe something has to do with our environment, or maybe something with the genetics. So Nepal,
Or maybe even lack of information.
absolutely. So these are the two most scary thing. Secondly, gallbladder. If we remove gallbladder, even after removal of the gallbladder, patient's life is not hampered in any way. See, most of the people are feared, are scared or afraid of the fact. Once they remove gallbladder, he or she will have difficulty in digestion of the fat or food containing some fats, right? But that is not the case. Okay. Reason being, the people are right in saying that bile helps in the digestion of fats. They are right in saying that. However, what they tend to forget is bile is prepared or manufactured in the liver. Okay, and there is a conduit which transfer. We call the common bile duct. From the bile is transferred from the liver to the gallbladder. It gets stored there. Okay, and once we take any meal, the meal goes to the stomach, and from there it goes to duodenum. Once it goes to duodenum, it releases the hormones cholecystokinin. What that does is that squeezes the gallbladder to pour out all the bile what has been prepared and stored there in the gallbladder, and that goes into the intestine through the common bile duct. Okay, if we remove the gallbladder, what happens? The manufacturing unit is still working. I mean the liver. We haven't touched the conduit, that is the common bile duct, connected to the intestine. So there is nothing. There is no harm in removing the gallbladder. That
भनेपछि त्यस्तो हार्मफुल छैन.
छैन, एब्सोल्युटली. त्यस पछाडि धेरैलाई कमन मिसबिलिफ अब कमन मिसकन्सेप्सन के छ भन्दाखेरि त्यही चिल्लो पस्दैन कि भन्ने, बट द्याट इज नट द केस. यु क्यान ह्याभ वाट एभर यु फिल लाइक आफ्टर द सर्जरी. सो पहिला जब हामीले भनौँ न, हामीले त होइन, हामीभन्दा अग्रजहरूले पित्तथैलीको जुन पत्थरीको अपरेसन गर्दाखेरि के गर्थ्यो भने पेट खोल्ने, त्यस पछाडि गलब्लाडर खोल्ने, अनि पित्तथैली खोल्ने, अनि ढुङ्गा निकाल्दैन, फेरि त्यसले चिलाइदिने. र त्यो बागेरमा के भने धेरै मान्छे मर्न थाल्यो, किनभने गलब्लाडर चिलाएको मिल्थेन, अनि त्यहाँबाट बाइल लिक भएर इन्फेक्सन भएर मान्छे मर्न थाल्थ्यो. त्यसपछि दे हेभ स्टार्टेड रिमुभिङ द गलब्लाडर इटसेल्फ बिकज द गलब्लाडर इज डिजिज्ड. भनौँ न पित्तथैलीमै रोग लागेको छ, त्यसैले त्यसलाई निकाल्न थाल्यो. सो बिकज अफ द एडभान्समेन्ट इन अदर एस्पेक्ट अफ द मेडिकल साइन्स, most commonly the anesthesia part. Okay, anesthesia has become much safer these days.
Right.
So because of that, the surgery has become very easy, and the patient don't tend to have like a long-term complication out of it. So because we advance it, everything, it has become easier one.
Okay, so मैले quickly question गरेँ हैन. So usually अब गुगलमा चेक गरेर हुन्छ, मैले अथवा विकिपेडियामा कता कतामा चेक गरेर हुन्छ हैन. Can you tell me what's the exact time of recovery for a patient who has operated with the laparoscopy, gallbladder stone निकालेपछि exact time? अब गुगलले के भन्छ भने usually it takes up to 4 to 6 weeks to recover, right?
Yeah.
तर what's your answer to it?
See, recovery depends on the mindset as well, and the how people is motivated out of it, right?
Right.
So basically what happens if we call like complete recovery. By complete recovery we mean that all the wound is healed completely, and the scar is get molded, and it become normal. It might take up to 2 years, forget about 2-3 weeks. Okay. However, patient is allowed to carry out the normal activities,
Okay.
what he or she has been doing before operation, just after 24 hours after this surgery.
Okay.
Right? So, what we do is, after 3 to 4 hours after surgery, we allow the patient to take everything normally, what he or she has been taking before surgery. Okay? And the very next, maybe the same evening, we tend to discharge the patient and resume the normal office works just within 48 hours. So, if you ask me, recovery is over by 72 hours. Now, patient can resume his normal activities, whatever he or she has been doing before surgery.
Okay, I'll come to Aginako point in a bit, but ठ्याक्कै मेरो दिमागमा strike भएको, since obviously a patient is asking a doctor.
Yeah.
Right. So usually के हुन्छ भने अब मान्छेले के भन्छ भने चाहिँ अब जस्तै one of my friends also had the gallbladder stones removal and everything, and she told me कि beans र dairy productsहरूबाट दूर बस for the time being, because that will slow up your healing process and all भनेर भन्छ. अब कसले भन्छ no, you're not allowed to drink or smoke हुन्छ नि for some time until unless you are completely recovered. के चाहिँ गर्न मिल्छ after recovery, के चाहिँ like apart from normal activities, के चाहिँ गर्न मिल्छ त apart from whatever I've said to you अहिले?
Coming to the point, milk and dairy products, we encourage people to take that because it contains a lot of protein and all the multiple vitamins are there. So that will in fact enhance the recovery, okay, in healing the wound. That will help that, okay. So that is one part. I think I'm clear about it. Regarding smoking and drinking alcohol, we don't ask patient to do that because smoking definitely delays the healing process. Okay, so we ask people to abstain from the smoking. Otherwise, also.
Like कति टाइमसम्ममा चाहिँ drinking or smoking चाहिँ?
If you ask me, I will never allow a patient to have a drink, smoking and drinking. Okay, so it's not about the time.
No, but usually अब जो मान्छेहरूको त्यो आदत छ, for example, जो मान्छेहरूको आदत छ, not me, don't look at me.
Okay.
I'm a very good boy.
सर सर एकचोटि यहाँ आउनु न.
तपाईँ यता आउनुहोस्, हामी यहाँ काम गर्दैछौँ.
अर्को सर यहाँ आउनु न.
ए भाइ काम गर काम.
कस्तो मान्छे नमान्ने यार भनेको. मदन बहादुर नाउ यता नाउ भने यता नाउ.
किन नआऊ?
यता नाउ न भने. अरे नाउनु भने हत्तेर कस्तो.
किन भने किन नआउनु?
नाउ भने क्या कस्तो तिमी भन्यो कुरा.
ले
उता जानु हुँदैन क्या. ल
ले के गरिहाल्यो?
त्यो टावर छ नि त्यहाँ विकिरण भन्ने हुन्छ अरे होइन, त्यसले मान्छेको स्वास्थ्यलाई नराम्रो असर गर्छ अरे क्या.
कसले भने?
हल्ला सुने.
जनताको स्वास्थ्यमा विकिरणले असर नगरोस् भनेर विश्व स्वास्थ्य संगठनले तोकेको मापदण्ड पूरा गर्दै टावर निर्माण गरेर सञ्चालनमा ल्याएको छ. ढुक्क हुनुहोस् र दूरसञ्चार सेवाको उपभोग गर्नुहोस्.
हो नि, संसारमा सबै देशहरूमा यस्ता टावरहरू हुन्छन्, त्यहाँ पनि मोबाइल इन्टरनेट त्यहाँ पनि चल्छ. हाम्रो देशमा पनि त्यस्तै त हो नि.
हट्यो यो टावरको विषयमा जुन मलाई एउटा भरम थियो नि, आजदेखि त्यो भरम हट्यो.
अबदेखि हल्लाको पछि कहिले नलाग्नु.
लाग्दैन तिम्रै पछाडि लाग्छ है.
Like जो मान्छेहरूलाई आफ्नो अब ड्रिङ्किङ अथवा स्मोकिङ एक्टिभिटिजहरू नर्मल गर्नु छ भने लाइक to what time should they be able to do that after their surgery?
I think anyone on this earth should abstain from doing all these activities. Not forget about after surgery. You are asking a judge how much money can I steal from a bank? It's not like that. Okay,
right.
So smoking and drinking should be quitted for all of us. It's not at all good for health.
यस्तो हो नि त. As a doctor, you have to promote a good lifestyle,
Absolutely.
good, healthy lifestyle and everything. Like तर कति भ्युवर्सहरू कति मान्छेहरू त्यस्तो पनि छन् नि त कि होइन त्यो त हुँदै हुँदैन नि भन्ने पनि हुन्छ. So that's the question is for them actually. So
they should come to us. We will help them get rid of smoking and alcohol. We'll help them. Yeah.
Okay. So now coming back to the point where you said कि surgery पछि चाहिँ within 24 hours or by 48 hours you are allowed to have anything that you feel like.
Yeah.
होइन जुन अस्ति जुन मलाई हस्पिटलमा भनिसकेको थियो कि यार why didn't you have दाल भात मासु तरकारी and everything.
Yeah.
I was shocked for a second and I was like, बिरामी
crazy.
उठाए पनि छैन, बेडबाट उठाए पनि छैन, हिँड्न नि त्यस्तो राम्रोसित सकिरहेको थिइनँ. How can I expect to have दाल भात मासु तरकारी? But then like after whatever example that you said, or the nurse have told कि okay हाम्रो यस्तो चाहिँ भएको थियो, यसरी भएको थियो, I went out there and all these things, that's a very different perception, that's a very different thinking from other doctors कि लिक्विडहरू बढी खानुपर्छ, ठिक हुन छिटो हुनुपर्छ, यो गर्नुपर्छ भने. What is it like? Is it हुन त that's okay to do जस्तो त लाग्छ मलाई पनि, but still, what is it like?
Basically we are governed by our mind many times, right? And हाम्रो माइन्डले के गर्छ भने तपाईँको एउटा पूर्वाग्रह एउटा जब पहिले आइसकेको हुन्छ नि त्यसपछि त्यहाँबाट निस्किन एकदमै गाह्रो हुन्छ, right? So like you are the live example, I can say, like I can quote that, like after like surgery we allowed you to have whatever you feel like, and you had that. Now you tell me, did you have any difficulty after the surgery?
Okay, if you have to ask me, then yeah, अलिअलि पेन like stitches or अलिकति पेन भएको थियो.
Absolutely.
अनि खाना खाँदाखेरि चाहिँ अलिकति जुन हुन्छ नि like if you're having more than what you are having, then चाहिँ पेट दुख्न थाल्छ.
Absolutely. So normal diet जुन अरू बेला तपाईँ लिनुहुन्थ्यो, yes अलिकति चाहिँ त्यसमा कम जस्तो चाहिँ हुन्छ, तर as such तपाईँलाई केही गाह्रो त भएन. मैले तपाईँलाई नर्मल डाइटै दिए हो. मैले तपाईँलाई तपाईँ भोलिबाट स्विमिङ जानुहोस् मैले भनेको थिएँ. Am I right?
Right.
होइन, though you didn't go, it's cold out here, होइन.
So गर्मी आउँदैछ.
So गर्मीमा त जान सकिन्छ. So what I'm trying to tell you was कि यसमा केही आत्तिहाल्नु पर्ने, डराउनु पर्ने होइन छैन. If you ask me, I operated on my own father. I think I did share with you. So I operated my own father. मैले दिउँसो बिहान 9 बजे अपरेसन गरेँ, दिउँसो 2 बजे घर लिएर गएँ र बाउ छोरासँगै बसेर भात खाएको हामीले.
Wow.
My father doesn't take non-vegetarian, neither he takes प्याज or लसुन. So garlic र ओनियन पनि खानुहुन्न because of his धार्मिक बिलिभ.
Right.
होइन. सो हामीले प्योर भेजिटेरियन डाइट बाउ छोरासँगै टेबलमा बसेर खाएको. द सेम डे 9 बजे अपरेसन गरेको मान्छे 2 बजे घर लिएर गएर खाना खाएको हामीले. सो आई नो एक्ज्याक्टली वाट इट इज. वान मोर थिङ कि हामी जुन खानेकुरा खान्छौँ त्यो हाम्रो ग्यास्ट्रोइन्टेस्टाइनल ट्र्याकबाट जान्छ. गल ब्ल्याडर इज कनेक्टेड टु इट, बट वी डोन्ट टच द ग्यास्ट्रोइन्टेस्टाइनल ट्र्याक. So we don't disturb that. We don't either put stitches or anything like that.
Right.
So in that Pakistan there is nothing harm in taking the meal. And जुन liquid diet को कुरा जन कतिपय मान्छेले गर्छ. So whatever diet you take, even you take meat or you can anything, you tend to chew it. Okay, we like when we ingest it and like when we swallow it basically, then it has already turned into the liquid, like boluses we say.
Right.
Right. So whatever you take, it goes into the intestine in the form of liquid only. त्यो लिक्विडको कन्सन्ट्रेसन मात्रै फरक परेको हुन्छ होइन, राइट. सो किनभने हाम्रो दाँतले चपाउँछ, मुखमा चाहिँ तपाईँको डिफ्रेन्ट एन्जाइम आउँछ, फ्लुइड आउँछ, सेलाइभा आउँछ, सेलाइभालाई त्यसलाई डाइजेस्ट आई मिन बोलस भनाउँछ, त्यो चाहिँ हामी स्वेलो गर्छौँ, इन्टेस्टाइन यसमा के स्टमकमा जान्छ. स्टमकमा तपाईँको डिपेन्डिङ अफ द नेचर अफ द फुड 2 देखि 4 घन्टासम्म त्यहाँ बस्छ. त्यहाँनिर त्यो हाम्रो स्टमकले पनि त्यसलाई पचाउँछ, सानो सानो टुक्रा बनाउँछ, त्यसमा ग्यास्ट्रिक जुसेस मिक्स हुन्छ होइन. त्योभन्दा तल जान्छ ड्युडेनमा, फेरि बाहिर आएर त्यो मिक्स गरे हुन्छ, पेङ्क्राटिक जुस आएर मिक्स गर्छ. सो जब इन्टेस्टाइनमा जान्छ त्यसलाई चाहिँ एकदम प्योर लिक्विड फर्ममा भइसकेको हुन्छ. So there's nothing to worry. So once we know the basic physiology, then it becomes easy. Unfortunate part is that it has been being practiced from like many decades or many years. Like अपरेसन गरेपछि आज चाहिँ नि पहिला कालो चिया खानुपर्छ, त्यसपछि तातो पानी खानुपर्छ, त्यसपछि सेतो चिया खानुपर्छ, दुध चिया खानुपर्छ, त्यसपछि जाउरा खानुपर्छ. Now it's not like that after the minimal. So this is the advantage of having minimal invasive surgery basically.
Right.
The laparoscopic surgery we were telling. Yeah.
Okay. So we'll cut short about because we are almost on our end.
Yeah.
So before that, तीनटा question चाहिँ म सोधिहाल्छु हैन. पहिलो कुरा चाहिँ के हो भने चाहिँ जस्तै सिन्स अब कतिजना मान्छेहरूलाई अब खाना खान सकेन लाइक इफ यु डोन्ट ह्याभ एन हेल्दी डायट अर अ नर्मल डायट
Absolutely.
अर इफ यु बी लाइक बिहान खायो त्यसपछि सिधा मात्र बेलुका खायो ग्यास्ट्रिक फर्म हुने त्यसरी हुन्छ नि मलाई त ग्यास्ट्रिक भयो एन त्यहाँ हुन भन्छ कतिजनाहरूको हुन्छ होइन मेरो पनि एकजना साथीको चाहिँ के भएको थियो भने चाहिँ लाइक खाना त खाइरहने तर ग्यास्ट्रिक भइराख्ने त्यस्तो खालको पनि केसहरू छ कसैको त अब मेरै केसमा भन्यो भने बिफोर माई पोस्ट सर्जरी लाइक बिफोर सर्जरी प्री सर्जरीसम्ममा चाहिँ अब बिहान खाना खाइसकेपछि आई बी आउट अनि त्यसै दिउँसो त्यति केही खानपान हुँदैन सिधै बेलुका हुन्छ होइन त्यस्तो हुन्छ एन्ड ग्यास्ट्रिक फर्म द्याट वे होइन अब कुनै मान्छेहरूको त्यस्तो केसेसहरू हुँदैन सो इन सर्ट इज द्याट अ थिङ टु वरी अबाउट कि ओके ग्यास्ट्रिक भएको छ कि छैन कि हाउ डु यु नो द्याट इन सर्ट
Regarding the food habits, what we say as a gastrosurgeon, what we say is कि हरेक 2-3 घण्टामा पेटमा केही न केही जानुपर्छ
एक्ज्याक्टली
ओके बेस्ड इन अ स्मल एमाउन्ट एन्ड वी टेल इज मल्टिपल स्मल मिल भन्छौँ हामी टन्न खाने हामी कहिले पनि भन्दैनौँ राइट सो जुन हामी आम नेपालीले बुझ्ने तपाईँको ग्यास्ट्राइटिस छ जुन ग्यास्ट्रिक हामी भन्छौँ सो प्रोबेबली द्याट इज बिकज द फुड मिसम्याच ओके पाएको बेला टन्न खाइदिने त्यसपछि 5 घन्टा 6 घन्टा केही खाने हामी के भन्छौँ भने 2-3 घन्टामा खाइराख्नु भन्छ एज सच हामी डराउने भनेको ग्यास्ट्रिक अल्सरबाट हो अथवा ड्युरिनल अल्सरबाट हो यसको कज चाहिँ नै ब्याक्टेरिया हुन्छ सो बिफोर वी लेभल समन इज ह्याभिङ ग्यास्ट्रिक वी हेभ टु गेट इन्डोस्कोपी डन and see if there is an ulceration or if there is some abrasion or something anything like that and if it is there it has to be treated this problem most commonly is because of the irregular food habits okay तपाईको 12 घण्टा 13 घण्टा कोहीको मान्छे 5 घण्टा 6 घण्टा केही पनि खाँदैन बट स्टमककोमा जुन ग्यास्ट्रिक एसिड हामी भन्छौँ हाम्रो बेसी हाइड्रोक्लोरिक एसिड नै हुन्छ जुन स्टमकमा हुन्छ ग्यास्ट्रिक एसिएल नै हुन्छ हाम्रोमा त्यसले गएर के गर्छ भने म्युकोजालाई ब्रेक गरिरहेको हुन्छ किनभने खानेकुरा पचाउनुलाई त खानेकुरा नै छैन होइन हामीले एउटा ग्यास्ट्रिक एम्प्टिङ टाइम भन्छौँ सर्टेन खानेकुरा त्यहाँ गएर 2 घण्टा जति बस्छ कुनै 4 घण्टा बस्छ कुनै 90 मिनट बस्छ त्यसपछि त खालै हुन्छ अनि तर ग्यास्ट्रिक जुस त आइराखेको हुन्छ त्यसले के गर्छ भने त्यहाँको म्युकोजालाई त्यो सफ्ट हुन्छ त्यसलाई चाहिँ नै ब्रेक गर्छ एसिडले जलाउने त हो नि त
राइट
सो अल दिज आर बिकज अफ दिस कि इरेगुलर फुड हेबिट्स कसैले फास्टिङ गर्छ होइन लङ मन्थ फास्टिङ पनि गर्छ तर हामी के सजेस्ट गर्छौँ भन्दाखेरि हरेक 2 देखि 4 घण्टामा डिपेन्डिङ ओभर यो हेबिट आफूले टाइट्रेट गर्ने हो केही न केही रूपमा खानैपर्छ हामीले हामीले अरू बेला खानेको के अरे भातै किन खानु पऱ्यो त बरु झोला हुन्छ हाम्रो 2-4 फ्रुट्स राखौँ होइन एब्सोल्युटली बट स्टमक चाहिँ खाली हुनु भएन सो दिस इज नथिङ टु वरी यस एट द सेम टाइम ग्यास्ट्रिक अल्सर छ कि छैन बिकज ग्यास्ट्रिक अल्सरको फेरि आफ्नै सिग्निफिकेन्स छ ड्युरिनल अल्सरको आफ्नै सिग्निफिकेन्स छ त्यो भनेर इन्डोस्कोपी गरेर चेक गराएर मात्रै हामी अगाडि बढ्दा राम्रो हुन्छ
ओके हाम्रो भ्युवर्सहरूको धेरै क्वेसन्सहरू छ यो केसेसहरूमा
हजुर
सो इफ यु हेभ लिसन टु दिस पार्ट प्लिज फलो गर्नु होला एन्ड फाइनल 2 क्वेसन्समा चाहिँ what do you want to say to our viewers, the first question, and the second question is what message do you have for me, because my guest are like so what message do you have for me? Let's go with the first question first. What do you want to say to our viewers?
To our viewers, I mean to what my personal suggestion as a gastrosurgeon is कि तपाईहरुलाई कुनै पनि बेला आफूलाई फिल हुन्छ नि पेट दुख्यो अथवा पेट ग्यास्ट्रिक अपसेट भयो अथवा ढ्याउडा कसैलाई धेरै आउँछ कसैलाई भनौँ न त्यस्तो बेलामा ग्यास्ट्रिक लेभल गरेर ओभर द काउन्टर ड्रग्स किनेर खानुभन्दा चाहिँ नि क्वालिफाइड डक्टरकोमा गएर एकचोटि आफ्नो प्रब्लम चाहिँ नि सल्भ गर्दा राम्रो हुन्छ
And don't forget to consult him at Grandi International Hospital as well.
And I mean जहाँ पाएको पर्छ बट क्वालिफाइड डक्टरकोमा गएर चाहिँ नि ओभर द काउन्टर ड्रग्स नलिने मेनी टाइम्स it will be like it will be shocking to you if I say कि कोही मान्छे यसै भनौँ न पेटमा समस्या हुन्छ औषधि पसलमा जान्छ औषधि किनेर खान्छ डक्टरलाई भेट्दैन बट when they come to us we have seen patient having advanced stage of gastric cancer.
Right.
Right? We have seen patient having advanced stage of gallbladder cancer. So, before taking any medication, right? Because taking medication is not normal. That's abnormal. हामीले कुनै पनि औषधि खानु भनेको abnormal हो.
Right.
हैन किनभने हामीलाई औषधि त पछि बनाएको देउताले त हाम्रो शरीर कति हजार वर्ष अगाडि बनाइदिया हो नि त हैन. सो औषधि खानु इज abnormal म भन्छु. So before taking any medication,
Right.
please consult a qualified doctor at place of your choice nearest to you where it is easy for you to visit. So that is the first suggestion I would like to say. कि यतिकै हावातालमा फेरि एउटा हिन्दीमा भनाइ छ जितने काले सब बापके साले भन्थ्यो के हैन. सो हामीहरुकोमा पेटमा केही समस्या भयो भने त्यो ग्यास्ट्रिकै हुन्छ.
त्यो assumption त्यही भइसक्यो.
Assumption भइसक्यो, but that not the case.
Yeah.
सो यसरी चाहिँ हुँदैन. हामीले चाहिँ नि यो पूर्वाग्रह त्यागेर बरु आफूलाई जुन हामीले ओभर द काउन्टर भन्छौँ औषधि पसलमा गएर हरेक दिन गयो अनि एउटा चाहिँ नि प्यान्टोप्राजोल whatever, I mean राबिप्राजोल मेनी हैन त्यो थुप्रै छन्. त्यो लिएर आएर खानुभन्दा बुद्धिमानी केमा हुन्छ भने आफ्नो चाहिँ नि एकजना क्वालिफाइड डक्टरकोमा गएर देखाएर त्यस पछाडि खाने. द्याट इज द फर्स्ट एडभाइस. नाउ कमिङ टु यु, लाइक मैले तपाईँलाई पहिला पनि भनेको थिएँ, यु क्यान रिज्युम अल युर नर्मल एक्टिभिटी. एउटा सधैँ मान्छेले गर्ने हरेक काम तपाईँ गर्नलाई क्यापेबल हुनुहुन्छ. आई थिङ्क लास्ट विक यु वेन्ट फर ड्राइभिङ.
Yeah. No, yeah, I drove, but not much. 2 hours to drive गरेँ मैले.
2 hours around 100 kilometers होला.
अलिअलि पेन चाहिँ भएको थियो, but then yeah,
you could do that.
Yeah.
That's it.
Yeah.
That's more than enough.
Okay. So coming down to the final question, what message do you have for me? In short.
Yeah. So remain cool, stay cool. You have completely recovered. That's it. Have normal life.
So we would like to wrap up this video. Thank you so much, doctor, for your time, and thank you for coming here, and thank you for operating me.
Yeah.
म जस्तो हार्ड मान्छेलाई सफ्ट बनाउनु भएको छ हैन. Okay, so before we wrap down, I would like you to say to like, share, and subscribe to this channel. You don't have to be specific. Just say to like, share, and subscribe to our viewers.
Yeah. So Suvas, first of all, let me thank you. Like you have, gathered a lot of courage to come up and stand up after his surgery, maybe just within a week. So it's a really brave thing to do, and whatever you're doing is great. And to all the people who are listening to us, please don't forget to like, share, and if you have any question, you can put in the form of comment. We would like to come back with answer of your choice. Fine. Thank you.
So with that, thank you so much, doctor, once again. If you like this video, give it a like, comment down your thoughts below. Doctor सँग म comment share गरिदिन्छु. Please share this video as much as you can because this is very very important and very very helpful. So subscribe. त्यो आजकल YouTube मा अहिले सेतो कलरको त्यो subscribe बटन आएको छ, त्यसलाई चाहिँ subscribe गरेर कालो गरिदिनु होला. अरु भने त्यस्तै हो. Let me end this video and I will see you in the next episode. Until then, bye bye.
हेलो, ए कृष्ण प्रसाद, तिमी मेरो घरमा त्यो फोन लिएर आऊ त. फोन
भात खाने बेलामा किन बोलाउनु पर्यो होला? भात पुग्दैन फेरि.
भात पुग्दैन भन्ने कुरा गर्छ. जेलको भात खान जानुपर्ने हुनसक्छ अहिले कुरा मिलेन भने. ए कृष्ण प्रसाद, आऊ बस.
किन यस्तो हतार गरेर बोलाछ? के भयो?
त्यो फोन ल्याउ त.
फोन किन?
आफ्नो नामको सिम अरूलाई प्रयोग गर्न दिनु हुँदैन क्या. एउटाले दुरुपयोग गर्दैछ, छोरालाई प्रहरीले बोलाए. त्यसैले मेरो नामको सिम मैले लिएँ, तिम्रो नामको फोन तिमी लिऊ.
तिम्रो सिम मैले दुरुपयोग गर्छु होला त कहिले?
तिमीले नगर्ला हो, तिम्रो उसले गरिदिला, उसले गरिदिला. टाउकोमा किन बोझ बोक्ने दिमागमा?
ठिक छ,
भान्सा गरेर जानुस् न.
तपाईँ खानुस्.
कटहरको तरकारी पकाएको छु.
तपाईँ खानुस्.
काका त रिसाएर जानुभयो.
काका रिसाएर के भयो त? सिमको दुरुपयोग गर्दै भने अरू रिसाउँछन्.
आफ्नो सिम आफै मात्र प्रयोग गरौँ.